That is as it is. Then you can now start off, Mercy. Michelle is also back. So Michelle, you can now guide it from here as Mercy takes over.
Okay, thank you so much, David. I had some internet hitch, but now I'm back. I assume that you've already welcomed our speaker today, Mercy Munyao, who is the social media agent. Taking too much time, Mercy, feel free to unmute, introduce yourself, and kick off the session. Thank you so much.
All right. Thank you, Michelle, for the introduction. Hello, everyone. My name is Mercy Munyao. I'm the social media agent in working for Maristops Kenya. So I want this session, being the last one, to be as interactive as possible. So I'm here to learn as much as I'm training. Sawa sawa. So I'll present my screen. So I'll be taking you through the social marketing in advancing access to SRH and services, but more of social media, how to tap on social media. So just a few, let me project the screen. Michelle, kindly confirm you can see my screen.
Yes, I can see your screen.
All right. Okay, just a moment. Okay. So we start off, then I need you to tell me, when you hear social media, what comes to your mind?
Hello, we can see your screen.
Oh, okay. Yeah. So I need the participants to tell me, when you hear of social media, what comes to your mind, or what do you understand by social media? You can type in your answers. I'm waiting for you guys to type in your answers. When you hear of social media, what comes to your mind? Or what do you understand?
We are typing, or we are speaking? You
can speak or you type.
Okay. I think from the word social, it's about interacting, and then now media is a channel, a channel where we interact with other people on different. Maybe on different agenda. Maybe it can be business, it can just friendship, communication, like that.
All right, perfect answer. Anybody else?
I think I can say that what comes into my mind when I see social media is visibility part of it. How visible are you in the social networks? Yes.
All right. Thank you for the answers. So social media is any digital tool that allows users to quickly create and share content with the public, yeah? So some of the major social media platforms that we have currently, there's TikTok, Facebook, Twitter, Instagram, Snapchat, and YouTube. Now, when you look at all these social media platforms, which one do you think are best? Which one do you think would be best for the youth? And why? I'm waiting to see your contributions. I told you it will be an interactive session, not only me just training. I don't want to bore you on the last day, yeah?
Kindly please repeat the question.
So I'm saying, I've just listed some of the major social media platforms, which you can see on your screen. So my question is, when you look at all these platforms, which one do you think would be best to use when targeting the adolescents, rather the youth?
I think for me, it can be Facebook. and TikTok, because TikTok is more visual. So they want something which is visual and it doesn't involve a lot of like reading.
Yeah.
And now Facebook being a platform whereby it's you can put any information for all the ages. Yeah, so I think Facebook and TikTok.
Yeah. So TikTok will be a good channel, considering you can upload short videos. And you see, with this generation of ours, if we can see something that is more visual and like very wordy, that's where most of the traffic flows, yeah? So we can go with TikTok, but not forgetting Facebook as well, because Facebook has a large following. So when we get to upload content that is targeting the adolescent on Facebook, it will be good maybe for reference and sharing and whatnot, yeah? So we proceed. And Twitter is basically maybe that time that you want to create awareness of your brand and you want more people to get to know what you do and all that, yeah? So you can use Twitter, yeah? So we proceed. So social media marketing, yeah? So when you look at the users on social media in Kenya, it has increased by 2.2 million. So that is 25% increment between 2020 and 21. So you see that's in 1 year, we have 25%, meaning as we move on, more people will join social media. So it will be good to leverage on that, yeah? So the number of social media users in Kenya was equivalent to 20.2% of the total population in January 2020. So just like I've said that, more people are joining social media platforms, so it will be best to leverage on that, yeah? So then social marketing can help to focus on specific priority behavior we can realistically influence. So what this means is the social media provides analytics for you. So it gets to tell you what your audiences are, what kind of posts that your audiences are interacting with, yeah? So let's say, for example, if it's video that is getting more views and likes and whatnot, you get to know now you move from static posts to videos, yeah? I hope I'm making sense. Social media gives you the ability to showcase your products or services, improving the lives of your current customers. Just like I told you initially, some of these channels, you can use them for brand awareness, like Twitter. Then if you really want to sell, you can do that on Facebook and Instagram. Sawa sawa. Then it can also, social media can also encourage others to improve their lives in the same way, depending on what the kind of content that you're uploading on social media. It might influence other people maybe to change their lifestyle. Let's say it's a particular product that you're selling, yeah? Maybe let's say like at the moment in our center, we are pushing a product called the Active Girl, eh? So it helps, let's say, ladies who have acne, irregular menstrual period and all that, yeah? So if we continue to post that, if we continue to post regularly, most people will get to see that. And let's say if there is any lady out there with irregular menstrual period, they might purchase that. So that means they'll have changed their lifestyle a little bit now by buying this product, yeah? Then I move on. So just a moment. Sorry. So we are moving on to the advantages of social media, right? So social media will help you increase your brand awareness. So the most important aspect of a company is to have their brand available and visible on social media. So that's how customers get to know about your products and the services that you offer, yeah? Then we go to more inbound traffic. So the moment that you've created awareness and people know the services that you offer, or rather the products, that's when you get now people inquiring more of your services. And also the call to actions that you get to put on the post, people now get to chat you. If let's say your call to action was chat us on WhatsApp or inbox on our Facebook pages, you get now the messages and the calls and whatnot. Sawa. Then now from the inbound traffic, that now will translate to higher conversion rates, or rather increase your sales, yeah? So with increased visibility, your business gains more opportunity for conversion. So every blog post that you upload, image, video, or content or comment that a client leaves will lead to viewers your company websites and increased traffic. So let's say if you want more traffic on your website, you leave your website link. Sawa. Let's say if you are working for Maristopes, when you go to the field, you can always show the adolescents, this is our website link, or give them our WhatsApp number. Sawa. Okay, then, or maybe does any one of you have any other advantage of social media marketing? Any that you know, apart from the ones that I've mentioned? These are just few, there are many more. Anyone? Anybody?
I would say it helps you form actually a network of like-minded people. For example, if you are in the SRH, sexual reproductive health space, there's a higher likelihood that you'll network with other organizations working around the same aspects. So that gives you networking within that space. And you can leverage that kind of brand availability as well, brand awareness and brand presence.
I was really looking forward towards that answer. Thank you so much. Thank you. Anybody else?
Yes, and also.
Sorry, Mudhoni?
You're on mute, Mudhoni.
I'm saying it can be used as a resource mobilization platform, whereby if you have a particular activity or something that maybe you need support, you can get support from people.
Okay, so for mobilization, right?
Yes.
Okay, perfect. Anyone else? Anyone who feels like we've left them out? Nobody? Okay. So we proceed. How to choose social media channels. So quality always will triumph over quantity. So it's better to choose 2 or 3 channels and post high quality, engaging content consistently, rather than spreading yourself over more channels and posting low quantity. So what this means is you'd rather have maybe a Facebook page where you're really posting more content and consistently, other than you create a Facebook, a Twitter page. Yet when people go to your Twitter page, the last time you posted is in 2018, yeah? So you would rather have a Facebook page, only a Facebook page where you can post more regularly, yeah? And also posting high quality content. Sawa. What do you think are other factors that you might consider when choosing a social media channel? We've looked at the channels at the beginning of the presentation. So what other factors?
Whether your target audience is in that platform. For example, if I'm dealing with elderly people, there's no likelihood that I'll find them on Facebook or TikTok. So my mom won't be on Facebook. If I go to Facebook and I'm looking to get to engage with her cohort in that platform, that won't work. So I have to target the platform I'm using with the people who are actually using that platform.
Okay. So good point. So assuming we are targeting, though I know we are focusing on adolescents, but maybe if we are targeting older people, do you think which social media will maybe favor us?
So if we're going for older people, we could look at some are in Twitter, the informed ones, or alternatively, we could have like the physical meetings with them in their local community. That is why chamas and barazas are thriving in dealing with elderly people. For young people, we'll use social media platforms, and especially adolescents, you'd see most of them are active on Facebook, Twitter, and TikTok. They're not much on Twitter because the Twitter is on another level on its own.
Okay,
then
okay.
Instagram as well for young people.
All right, all right. So do you think if we use SMS to reach the older people, it would benefit us?
Yes, it would.
Maybe SMSs.
Yes, messages would work.
Mudhoni looks like she's disagreeing.
Yeah, because some of them they're even struggling how to read. So I think we can either do a call or just that physical meeting. But SMS, I don't think it's going to work.
We are not talking about the socials, Mudhoni.
Yes.
Not the socials. Maybe someone between let's say 50 and 60. Between 50 and 60, maybe. Even to some extent 70. I don't think a 70-year-old is that much old.
Yeah, they are not that much old, but even maybe sometimes responding or comprehending the message on how you intend it to be responded, it might be a bit difficult. So I think a physical one can work for that.
Would be better.
Yeah.
Or even a call, just like you said.
Yes, or even a call.
Okay, okay. So from this discussion, what do you think, or what would you drive towards? Because I'm seeing most of you are saying we really have a better chance in social media when it comes to the youth and adolescents, right? So let's leverage on that. Sawa sawa. So we proceed, and some people are really quiet, like Kate Terra. I haven't heard your voice. Okay, okay.
I'm at the chat box.
Oh, okay, okay.
Yeah.
All right, so let's proceed. So, why do you think we need to target the youths on social media? Yeah. So, survey shows that 90% of teens aged between 13 to 17 have used social media. Then 75% report having at least one active social media profile, and 51% report visiting a social media site at least daily. Now, with these numbers, this tells you that we really need to do a lot on social media, yeah? Then it is an important part of socializing and connection in the modern world. So teenagers and social media use is increasing. And the main reason teenagers regularly use social media include talking to their friends, yeah? So social media can affect teenagers in both positive and negative way. Research has found that social media use can affect self-esteem and make typical teenage pressure and bullying worse. But it can also connect isolated teens and help them find supportive networks. So when we create these social media pages, yeah, we are not only posting about the products and services that we offer. You can choose maybe like Monday, you'll be posting motivational posts, yeah? So let's say if there's a teenager who is following your page, when they bump on that post, at least they boost their self-esteem, yeah? And let's say sometimes maybe when they bump on that post, they didn't have someone to talk to, but once they get to view it, they will chat you and maybe tell you, I'm going through this. So in the same way, as much as you're offering these products and services, you'll end up now being a counselor, yeah? But you see, after the counseling, you might end up converting this client, yeah? So you'll end up selling your products and your services, yeah? So what is the other reason that you think is important for us to target the youth on social media? Why do you think that targeting youths on social media is important?
Oftentimes,
yes, can you hear me?
Yes, I can.
This is Austin. I can say that social media as a platform is the most tool that most of the youth access so easily. That's why it's highly needed in terms of targeting the youth, because it is easily acquired by the youth. It is easily accessible to the youth as compared to any other means of communication.
Yeah. Okay, nice one. Anybody else?
I'm saying that based on socialization. Yes, someone has something.
I'll go after you.
Oh, okay. I'm just saying that most of the people, young people, you feel in the age group of 13 to 17, they're at the point of getting to know themselves, self-awareness, and all that. And therefore, most of the things that they want to know, they are not free asking elderly people in their communities and such. And therefore, they use social media to source for that kind of information. So when you target them in that platform, you're giving them an avenue to get the information they need and also to be there for them when they need that service and support.
Yeah. You see, like maybe as if a 17-year-old or maybe even a 16-year-old is sexually active, they really have so many questions and they can't go to ask, let's say, their aunts or their moms or even their sisters. They are afraid, yeah? So most of them, they will go online to search for this information, yeah? So thank you. And how do we pronounce your name? Rai Culture?
Rai Culture is the organization. I'm Odhiambo David.
Oh, okay. All right, okay. So we proceed. So these are some of the tips when you're creating a social media campaign. So you need to align your campaign messaging with your organization's missions, the vision, and the strategic goals, yeah? Then clearly define what success looks like for you. So are you looking for followers? Is it more of WhatsApp inquiries? Are you looking forward to having more calls? Or you really need to define what success will look like for you or your organization. Sawa. Then you also need to know your audience. Don't just say that you're communicating to the general public, yeah? So you need to do like a segmentation. So let's say you need also to define what age group are you looking forward to targeting. Then use the same keywords across your marketing strategy. Let's say, for example, if you want to reach them with sexual reproductive health services, those are some of the keywords that need to be consistent across or during the campaign. Then make it more human, personal, and verified. So use text, videos, photo essays that make your campaign fun. Also remember to ensure videos are closed captions for them. You see, some people, let's say they bump on your post when they're in a very loud matatu. So if you have like the captions below the videos, they will get at least to understand what is happening or what is being communicated. And like if it's just, it doesn't have the captions, yeah? Then lastly, have a clear call to action. So the call to action is what maybe you need also to discuss when you're defining what success will look like for you. Let's say if you're looking for a number of views on the videos, your call to action should be click here to watch. Or maybe if it's more traffic to your website is click here to read more on our website. Sawa. Then we proceed to, so I think this one we've discussed. So some of the important things to remember when doing a social media post is you need to choose an appropriate media or channel. Just like we've said for Twitter, we can say it's for the elderly. Then if it's TikTok that you've decided to go on because of the age group that is in that channel, so you need to choose an appropriate media or channel. Then use more images than words. I think these days there's a saying that says images speak louder than words, yeah? But then we always have a call to action. At the end of your post, always have a call to action. For example, you can see like for us here, it's WhatsApp this number, yeah? So that is our call to action. Then respond to questions asked as fast as you can. So not a lot of people who come online to search for information or maybe they want to purchase a product or services, they are not that patient. So let's say they'll chat like 3 different pages at the same time. And the one who gets to respond the first one, that's where they'll end up going to access the service. So make sure you respond to the questions as fast as you can. So this now is an example of an image that, so here we used more images than words. So this was done yesterday. It was International Men's Day. When you look at that image, what do you see? Do I need maybe a caption or more words, Mudhoni?
The product and the message is home.
Exactly, right?
Yeah.
So
yes.
no one needs to tell you this is a page pushing for condoms, right? Yeah. Then below there it communicates it's International Men's Day. Yeah. So this is what I mean by use more images than words. Sawa sawa. Then we proceed to the don'ts. When you're doing a social media post, you need also to focus on quantity. You need to focus on quality over quantity. Pardon that. So for example, like the previous post we've seen, assuming maybe we had so many posts written Happy International Men's Day and all that. So sometimes it's best maybe you just do one post. It's a quality post over doing several of them, yeah? Even people online will get bored of you and they might even unsubscribe from your channel, yeah? Then sometimes it's not best for you to, okay, it works and sometimes it doesn't work, being on all social media platforms. So that one should be informed by, let's say, what is the capacity? Are you able to post on all these channels that you've created, yeah? So like I told you earlier, there's no need for you to create like a Twitter page account, yet when people visit there, the last post they see that you've posted was done in 2018, yeah? So you'd rather have one page where you are posting consistently, yeah? Then use more landscape images and videos. Then, and this one actually explains why TikTok has more following, yeah? And soon it will beat Facebook, yeah? Because of the short videos, yeah? So people are more visual, yeah? Visual content sells more. Then not uploading videos to social media platforms will work against you. So this one is just the same as the first one. So if you create a channel, let's say like YouTube, don't post only 2 videos and say those ones will sell me. If you can post more videos, yeah? Then also use gadgets that will make the production easier for you and get clear images and videos. Sawa sawa. Then not boosting the right post will not work for you. Like for example, this one I tried to boost it, so it was rejected. And the reason is because, you know, Facebook has restrictions on the kind of content that you get to boost these days, yeah? So let's say if Facebook feels like maybe you are targeting a certain group of people or race and all that, they reject your post, so you are not able to boost, yeah? So make sure while you're trying to do an advert that you comply with the restrictions and all that, so also with the regulations, yeah? Then not replying to questions on social media will also work against you. That what I had explained earlier. So people will chat, will send messages or inquiries to various online pages just to see who gets to respond the first one. Sawa sawa. And I think I'm done. Okay. Any questions?
You talked about the don'ts where we are not supposed to be like in all the social media platform. Let's say, for example, I have like for Twitter, maybe it cannot target the adolescents, but maybe I can use Twitter to post like the activities that I'm doing, targeting maybe the donors or something like that. Not basically targeting the adolescents, but targeting the people who maybe work in the same field, and they can be able to support.
And networking. Yeah, I get your question. So my point was do not have all these channels if you know that you won't be active. So in your case, what I'm getting is, let's say if you create a Twitter account, it will be for your organization to network with like-minded organization. So that will be good if you'll be active, yeah? So what I was saying is, don't have all these channels if you know that you won't end up posting on the channels. But if you're sure that you'll be consistent on these channels, then create as many as you can, yeah? Yeah, I hope I have answered you. Okay. Any other question?
Maybe just to add on that, I think the other critical bit is aspect on market segmentation. I believe we had some mention of that last week. You know, you have a broad market as individuals within the spaces where you work. So one of the first things is you are targeting young people because of the services and because of the advocacy you are doing within that space. That is one of the market segments for the young people. Subsequently, you need funding and you need to sustain your work, and therefore you need networks, you need donors and all that. And therefore you need to also identify which platforms are these people are. So if, for example, I'm sending communication to my partners, then I won't do it on Facebook. I'll have to send an email. I'll have to go to Twitter maybe to just network with people in that space. So for the platforms that you're going to use in all your social media marketing and related work as young people within the SRHR space, will have to be dependent on who am I targeting? Where are they available? And which information do I want to convey to them at this platform? So that would be very critical. Even when you are doing your analysis before you set up these accounts, you can decide Facebook, I'll just be engaging with young people within that my community who are in that platform and all, which will work for you. I want to network with other established organizations in SRHR space, Maristops and related. Then I now need to be maybe in Twitter where they tweet and share their content. You'll be in that platform with them. So that is how you could do it and be strategic about it.
Yes.
Yeah.
Thank you so much, David. Yeah, thank you so much, David, for that. Muthoni, we have answered your question, right?
Yes, you have answered.
Okay. Anyone else? All right.
Yes, I have a question for you, Mercy.
Yes.
For these young people who are working in their own spaces, how can they leverage on the social media marketing work that you're doing at MSK, also for their work and also to support you in the same time? How can you create areas of collaboration and synergy?
Okay, that is, thank you, David, for that. So what we've initially been doing is, let's say for the people who are working on field, on the ground, that is, depending on the kind of activities that they have. Let's say, for example, if they are going, they have a date for offering family planning services, they communicate to, let's say, the person doing the digital bit earlier, then now they get to post the event that will be happening and the dates and the location and all that. So in that way, they'll be supporting them in creating awareness for the events and also help them in mobilizing. So what I'm saying is, you see, for them, what they can do, they can communicate the events that are going on in the field. And for the people on the digital end, what they can do, they can create awareness for them. Then for the people also on field, they need now to get more people following these pages, and interacting with them. So in the field, they can share the pages that have been created by the various organizations and also the WhatsApp numbers and all that,
That's awesome. So that's an opportunity for you to take advantage of the social media marketing platforms from MSK as young people. So that's key. Then there's another question in the chat box.
In case there's an upcoming event or there's an activity that is upcoming, you can always share, then we post on our social media pages, just to mobilize for you.
That's fine. And I'll also reach out in terms of the next steps. How do we engage and sustain this engagement moving forward? So I'll reach out, then we'll have a chat here. And then Monica has a question on the chat box.
Yes, Monica.
How do you deal with cyberbullying? Because some people do not like the content we post on SRHR.
So is it a client who's being bullied or is it us?
Monica, you can clarify.
The people being bullied is us. When you post about sometimes just blog about how young people should get this information about, talk about sex, about contraceptives. So then you get negative feedback from the community, and then from the comments. And then, you know, when the first person texts that, the other will just support it. So how do you deal with that?
Okay. So mostly what we do is, let's say if someone sends in a negative comment, it depends. If it's not abusive, let's say they're saying that we are pushing for adolescents to get contraceptives or they'll be barren and all that, we get facts and statistics, we share with them. Let's say like recently, last year, you've seen how we've had so many cases of teenage pregnancies, So if by issuing contraceptives, we can cap these teenage pregnancies, So we get to at least inform the client in a good way, So we get the statistics, we share with them. And now maybe tell them, if we did this, we can prevent this instead of starting curing now and discussing about the increased teenage pregnancies and saying all these children. And it's because, you see, most of these teenage pregnancies is because these guys lack information. So in one way, first we tell them we are educating the adolescents. And now for those who feel like they can come in and get, because we are not coercing them, so we just inform them this and this when you use a contraceptive, because you can just go home and tell them abstain, So we tell them if you're sexually active, you can come in for a contraceptive. And you get to tell the person who's commenting negatively there, if an adolescent get a contraceptive, maybe they'll even further their education and all that, But in the event that a comment is abusive, for us, we just delete. So that's how we handle the negative comments from our end. If it's abusive, we delete. If maybe it's just them trying to oppose what you are communicating, we get the facts.
Thank you for that, Mercy. And actually, it's a critical bit, because when we look at it from social marketing, it's about modeling behavior change. And everybody is coming from perceptions and their own notions of what they believe is right. So for us to change their mindset and convert them to be parts of our network and our advocacy agenda, then we need to give them the information in a way that they comprehend it. So the most critical bit is communicate the facts, communicate the rationale, and even use experiences that they have. Probably you're telling people about use of contraceptives, and they're telling you are encouraging young ladies and young people to engage in early sexual intercourse and all that. But you ask them, even currently we are having unwanted pregnancies and all that. We're having HIV infections at a young age because of the sexual debut, early sexual debut, without protection and without the relevant information. So these are things that are happening. How do we contain that so that we don't have the negative consequences? So you talk from a point of concern, that would be critical. Then other than that, then the aspect that you've mentioned about deleting or even blocking that kind of content, because those are people who can even dissuade members who are actually converted, who are working with you to promote the same agenda. So if they're not objective, you'd rather block them or even just delete the comment so that they're not shared with other people that might influence their perception. So that is a very great contribution there.
All right. Thank you, David.
Thank you.
Any other question that I'm
There's
missing
another
on
one
the chat?
Steve has raised his hand. Steve, maybe you can speak up before we read Cynthia's question. Yes, Steve.
Hello, thank you very much. Just I like the presentation, but I just want to ask one, how do you deal with because this is a matter of computation. How do you deal with the issues of opponents in your social media marketing? Then two, we know there are always issues of people using pseudo accounts. Maybe let me say conning reasons and the rest. You'll realize that they are just the exact products you post, the exact information you give. There's somebody using a pseudo account. How do you cross-check? For example, if you go to Twitter now, try to search for Uhuru Kenyatta, you'll get several people, the same picture, and the rest. How do you cross-check that to ensure that when you are doing social media marketing, these young people you are targeting who might not be at a position of knowing the exact thing on what to go for, how do you handle such?
Okay, all right. Thank you for that, Steve. So, like you said, even when you search for, let's say, our organization, Maristops Kenya, you'll get so many Maristops pages, yeah? So what we did for us, because we realized actually, just to, like you said, some of these pseudo accounts were even luring clients and offering false information and even conning them, yeah? So what we did for us is we got the blue badge for our digital channel, yeah? So for verification. So let's say even when you're on the field now, when you're telling someone, follow our accounts, follow our organization's page, you get to tell them, just check the one that has a blue badge, the blue tick, yeah? So that indicates that that is the verified page account, yeah? At least you get to distinguish yourselves from the pseudo accounts. Because what we realized, initially we tried to report the pages, but no action that was being taken on Facebook. So now the next point of action was for us to get verified. So once you're verified, even when someone comes to search, at least your page will appear fast. And also the other thing, when you post more, you get to work on your search engine optimization. So for anyone who comes online to search for your accounts, you appear fast, yeah? Then for the opponents is these are maybe organizations that are against the services that we offer, yeah? For example, like there's one that is called Citizen Go, which is pro-life, yeah? So what we used to do is the founder of the organization used to tag us in her comments. So if sometimes it's not all the time you get to respond to all the tags that have been made towards the organization, yeah? And then if it's something that is written to tarnish your name, you can choose maybe to write a press release if it's necessary. But if it's not, you can choose to ignore. Though ignoring sometimes is bad for your organization, because at some point they might influence people, then now you have a crisis to manage and all that, yeah? So always cross-check the comments that they are making to see if there's need for response or not, yeah? But if it's something that has been written to tarnish your name, you can always maybe just a press release, yeah? And also showcase the positive activities and maybe from your services. Let's say, for example, by offering contraceptives, how many teenagers are happy, sharing testimonials and all that, yeah? I hope I have answered your question, Steve.
Yes, yes.
Okay, David, anything that you want to add on top of that?
Yes, just a brief. In the aspect on competition, the aspect on competition that these people are against you, which is understandable, and you have to deal with it in that approach. The other thing that I know, one of the challenges we have is we feel somebody doing the same work is a competitor because probably they're invading into our space and probably we are like, it's like we are doing the same work, the different people of us. I think that for me, I won't consider it as competition. That is something that is actually somebody and organization that is validating the work you're doing. If I'm using the example that Steve gave where I'm sharing information about a particular thing in a particular way, and somebody is using the same information in their network, that is validation of the work you're doing. The only angle now is how do we, instead of competing in accessing the same group, how do we collaborate? How do we create areas of synergy such that now, if I'm reaching out to a particular community, we can work as a team. We create the same content together, we share it with others together. And it now becomes a movement of like-minded people reaching more people, and it even solidifies that effort. So let's not think of it as competition, but rather an avenue for collaboration. And that is one of the things that even as we're moving forward now for the SRHR Youth Champions Network, we are looking at how do we create areas of synergy where we work with young people in the different spaces. You might be 3 people, let's say, for example, you're in Homa Bay. The 3 people you are in Homa Bay, can you work together so that you have a concerted front that you can influence people rather than when you're going at a personal level? So that would be critical for me as well as we look at how that can move forward.
Actually, what I know for Mombasa region, what most of the organizations they have done, because I usually support them in creating awareness, Let's say, for example, if it's an international day, let's say for World Contraceptive Day. So what they usually do is they come together. Let's say, for example, Mary Stops, there's Stretchers, there's RHNC, I think. So what they do is each organization plays its role. Let's say like for, I'm forgetting the name. So there's an organization that will mobilize clients. Then there's one that will offer information during the event. Then now for Mary Stops will come in as a service provider. So we work together and it comes out perfectly, yeah?
Perfect.
Yeah, yeah. Any other question?
There was a question from Cynthia. And how do you deal with people who are creating a fake account? That one you've responded to?
Yeah.
So any other question, any contributions from you guys?
Have your expectations been met? Have we disappointed you?
Yeah, it's good we get that feedback.
Yeah.
I think
Michelle?
this has been quite an informative session. Yeah. Okay, my personal expectations have been met, and at least now I have some clear understanding of how to go about SRHR in social media platforms.
Okay, okay, thank you for that. Anybody else? Muthoni, are you happy?
Yes, I'm very happy. That's why I always put my video on so that the presenter can see whether I'm agreeing with something or not. So I can say it has really been a very informative session for me. And I always make sure I have my notes. If you can be able to see, I actually do them in a very nice way. I put sticky notes. So it's really a very good training. And thank you so much for using
such a good student.
Yes. Thank you.
Yeah.
Anyone else?
She's motivation.
Yeah.
Someone
Hello?
is speaking somewhere, yes?
This is Isaiah.
Yes, Isaiah.
Hi, Isaiah.
Hi. Thank you for this informative information or presentation.
Okay.
Yes, it is true that SRH in social media is bringing a lot of, raising a lot of concerns that I like the way we have approached it. In that, there are so many people that are talking about especially contraceptives for the young people. Yes, in hospital, we are allowed to support or provide services upon request. However, whenever there is maybe a forum for young people to be engaged on SRH, and we would like to also provide a service, then you realize you get a lot of, especially now when you are on social media, you get a lot of negative comments that we are trying to promote these young people on so that they become more sexually active. However, they are, yes, and they are engaging in sexual activities. That's why they have, there is a lot of increase in teen pregnancy cases. So
sorry, let me cut you short there before you proceed. So I need to understand, these negative comments, are they coming into your personal accounts or is it from the organization's page?
If you link your social media with the personal, so whenever you post, it also pops in your personal. And some of the negative is just about promoting that they feel the community feel or some individual feel that through provision of contraceptives promote. However, my defense has been, if you do and you tag like-minded organizations, you get positive comments, and in that perspective or during that discussion on social.
You're losing Isaiah.
these other people, these other organizations, like-minded organizations, who talk or who brings the perspective of negative comments. And some, if you follow them up now in their private accounts, then they say, no, we are just raising concerns. It's not that much alarm.
Yeah.
But now in the general public, it looks like it is an alarm. So it's very interesting. So I like the comment from Mombasa region. And I would like that now, moving forward as we engage in this, that we may strengthen this network so that whenever we do any post in relation to SRH, then we are able to tag all the like-minded organizations who are within this network, so that we are at least promoting, and it increases, it amplifies that kind of conversation or information.
Okay, all right. Yeah, I agree. If sometimes you tag actually like-minded organizations, they'll support you and they'll support your post and all that, yeah? So that's a good strategy.
Yes. And one of the things actually, based on what Isaiah has shared, what we need to understand is, from the hospital, these services are being offered. So why are they offering them if they don't want you to create demand for them?
Yes.
Because if you don't tell people these services are available, then they won't come for them. And the consequences will be there with us in the society where we live. So it's about creating demand for the services because they are already being provided.
Yeah.
I'm a pharmacist by profession and I work in the healthcare sector, and I see we have supplies of contraceptives, we have supplies of the condoms and all that. All the products and services are being offered. Even the clinicians and the doctors we work with, they're offering the services. But how comes then creating awareness about the availability of services becomes an issue? So you need to bring that perspective so that they understand it's not about talking about and encouraging people to engage in premarital sex and all that kind of stuff. At the end of the day, services are there. People need to use them. If not using them, then why are we budgeting for them?
Yeah.
So that would be a zero-sum game. So we need to build an argument and work together as a team so that when you speak on something, Austin, Isaiah is talking about something, Mary will be supporting in another level, Mudhoni on another level. So we have a voice that is augmented and we are driving a common agenda for the greater good of the society.
Yeah, another practical example, maybe just to wind up, is when we go to maybe provide SRH information in schools, and especially in the Catholic schools where they don't promote family planning, you get a lot of resistance. But now when you are giving information in one of the schools that really gave me a lot of hard time. So when we were arguing with the management, then we discovered that the same information we want to pass partially is provided in biology, and they are informed about contraceptives. So why is it that now when we want to bring a comprehensive sexual reproductive health information, including now life skills, then they become hesitant. So when we argued and we brought that perspective, now we are getting a lot of support from Catholic schools as far as SRH is concerned. So it's just kind of like the presenter said, lack of information. They don't have, and they don't know the content of SRH. So you'll get a lot of resistance. But now when you create for that platform to argue out the content of SRH, then we'll be able to penetrate through.
Also, just in addition, I really think this is the time we need to focus much on integration, such that we run away from standalone activities. For example, you might find this particular team offering services, and on a particular day that, let's say there is an outreach, the team will come to offer services. Can we walk along? There is a team that is, if there's a team that does demand creation in terms of awareness creation, when they go to the field to meet this, can they walk along with the team that offers services? So that, because there's also been a gap, I go to the community, create awareness, and leave. instructions that if you want these services, go at that particular point, go at that particular, of which they will not have time as compared to when you are with the service provider at that particular point. You get it? So
yeah,
I go to I meet these young people, I tell them this is, if you want to use, prevent pregnancy, you need to do this, there's issues of abstinence, there's issues of condom, and that condom is not in the picture. Based on structural factors, even within the facilities where they get these services, this person will not take time to go for this particular method of preventing pregnancy that you told him or her, which she or he could have gotten when you went together with this particular product. So it's a matter of integration. Then secondly, can we think around how we engage the private partners? Yeah, I'm talking about what were chemistry, what were pharmacists, because this is where these young people, with that ignorance, they go to that particular chemist or pharmacy to access these products, because this person is just here to make money. You will sell without whether this person knows or don't know about these particular things in detail. How do we engage them along this particular journey? Thank you.
Wow, Steve, now you came to my home. How do we engage pharmacies and chemists? So I think we have a role to play as pharmacists. And the challenging bit about the dynamics is pharmacies, most of them, we will have the professional code of practice, which is there. But at the same time, we are a society. And the society has its ills and goods. So they are the ills of the society that we have to make peace with. They are there. The only thing is, how do we address them and bridge the gap? And one of the critical things that actually in some of our discussions, I remember last week, but one we had the PSK, the Pharmaceutical Society of Kenya annual conference, where we are having discussions. Other than talking about contraceptives from a point of, these are being made available through pharmacies to the community. How do we engage the aspect on comprehensive sexuality, that is the education bit and the services in the pharmacy, so that when you come to the pharmacy, beyond just selling to you a P2 pill, selling you, what do we call them, the contraceptives and all, can I engage you and understand from what angle are you coming and what additional services would count for you? So those are some of the conversations that we're having, not fully established. And at the same time now, that is now another opportunity from my perspective for you young people who are working in these communities to form partnerships with them. If I'm running a pharmacy, I have the contraceptives, and I'm actually able to refer them to other hospitals for when they need additional services. You as a community player within the local community, you know people who need the services, and you're creating awareness and engaging with the community. Can you tap into that network from the community level and refer them to that facility or that chemist or pharmacy where they can get the services? And have a structured engagement where you are giving the information. You can even have them as clinic days on SRHR specifically, maybe a monthly meeting that you can have with young people who need the services. You educate them, you partner with the hospital to offer the pharmacy or the hospital to offer the services, and it now becomes structured. And that is one of the things that actually in the initial conversation that we're having with Maristop was the discussion is, Maristop has clinics all over the country. And with these clinics, we have young people who are in the community, and most of these young people might not know about the availability of the clinics. Can we work with youth groups and youth-led organizations within the local communities to be kind of a referral system? You are offering information about a service, but these people don't know where they can get the service. So you now know where the services are. We have a referral system, signposting kind of a model. Then you refer them to that service where they can get it. And then also it gives you a lifeline because you're now getting sustainable growth. You have a structure. You're not just talking because you want to talk. Beyond talking, you are helping people get the services they need. So that kind of arrangement is what we are looking at. And I think we can start it from our end, and also at higher levels when we engage with other stakeholders and all, we look at how do we push it better. And that will be now the form of conversation that we need to have as young people within the networks. I believe the next meeting that Michelle will organize for us, we are going to discuss this. It might be next week or the other week for us to just sit down and see what areas are we working with. Which interventions can we work on collaboratively starting the coming year? And how do we make it be impactful rather than just piecemeal projects that each and every person is doing one thing in a year and we are saying you are good to go. No. Mercy, I don't know if you have something on that.
No, I think you've well put it. You've well said it. So no.
Okay, thank you. That's good enough. So Michelle, it's like today we finished earlier than we had envisioned, but it's good you get extra time to do your things as well. So Michelle.
Okay, thank you so much, David, and thank you so much, Mercy, for the wonderful session. It was brief and straight to the point, and I also took a few notes, although Mudhoni has set the standard a bit high, but I've also taken a few notes on which social media platform is suitable for what, like what you said, Twitter for branding, Facebook for selling and all that. But all in all, I also think social media plays a role in documenting what you do as an organization, because sometimes we might not have that time of sitting down, writing reports all throughout the year, especially if you're running so many activities. But if you're constantly, like, if you have an activity, you post everything and you give a brief of it on social media platforms, it creates that whole process of documentation. And I think that was one of the objectives that we had as RaiCulture, to at least motivate you guys to develop a culture of documenting, because only when you document it, then people will be able to see what you have done. Otherwise, it has been an amazing session. It's been an amazing 6 weeks with you. I missed a few sessions, but then I watched them on YouTube, and you guys have made these sessions wonderful. And I know although we started with 300, we targeted 300 people, but for the few that we have managed to impact, and then we see the passion from you guys and how you're answering questions, you're bringing in discussions, it's encouraging us. And although this was a launch of this particular training, we will really hope to look at how best we could improve these trainings and even impact more people. I don't have much to say, apart from thank you so much, Mercy, for the amazing session. Thank you everyone for your wonderful comments and questions from the chat box. And kindly remember to fill in the feedback form. I have posted it on the chat, and I have also forwarded them in your emails. If you fill the feedback form, it then will give you a certificate and we'll be able to move forward with you for further engagements. Because through the feedback form, you'll be able to know that you have at least gained a few points from the trainings that you've had. So kindly remember to fill the feedback forms. If you haven't watched a session, watch it, then fill the feedback form afterwards. Otherwise, thank you so much. I don't know if I've missed anything, but I'm assuming that, maybe we could open our cameras one last time for one last selfie as a group, and we close up the session. Yeah, so if you're in a position to open your video, we'd really be glad so that you can post it out. And if you follow the RaiCulture social media platforms, kindly remember to retweet, repost, throw in a couple of comments, and we'll really be grateful. You could also post some of the photos in your social media platforms and tag RaiCulture. Yeah, so let's open our videos.
Justin has something, maybe she could say it as we get on our camera.
Okay. Justin?
Yeah, I wanted to request the presentation and all that we have done so far be sent via the email, please. If you can. You said that the sessions you'll be sending all of them. Don't forget.
Yes, we'll send all of them after all the sessions. Yes.
Okay.
I'm waiting to see some people that I've never seen, and now they are all turning off their cameras. So it's been a good one, and one of the things that are just as we finalize, I hope you guys, Michelle, you're taking the photos and all. One of the things that I just wanted to mention is the fact that we had to do some reporting on what we've learned and how we are doing it. So far, I have an organization that has been consistently sending updates Others have not been. Please work on those reports on how the sessions have been. That is one. Two, at the start of the session, there was some document that you shared, a brief overview of the organization, the work that you're doing. We are reviewing those and creating that content, which will count. And at the same time, we're asking of you, now with this information, you can target your information, you can refine the different areas of work. And then now when we are going to meet maybe next weekend or the weekend after, we need to have a discussion on which particular focus areas do you think are key for you in SRHR? Which components do we integrate in as we are continuing that advocacy work so that nothing is missed out? And it also helps you focus your attention other than doing everything, but with minimal impact in the terms of work you're doing. So that is going to be there. And then I just to reiterate one thing that Michelle mentioned is the fact that documentation is key. Unless it's documented, it never happened. And that is one principle that we use in the pharmaceutical processes. You know, the quality of the medicines you use and anything is important. So if I did some procedure in the laboratory and that measure was not documented, there's no guarantee that I did the right thing. Probably I'll be selling you unga and you're taking it as a medicine. That should not happen. So that documentation is key. The evidence that you're doing any work in your community is documenting it. We acknowledge all of us might not be able to have website pages and all that, but you can have a social media platform. Create one platform at least. You can do LinkedIn, Twitter, Facebook, at least have one, maintain it regularly, share content on that platform. And then now from the SRHR Youth Champions Network that is on the agriculture website, we are going to give you a platform where your content and the information that you're doing within the network as we move forward will be shared. So when you are pitching for any grant or any material, you can access that link on our website and use it in terms of promoting the work you're doing and communicating it to your partners and your stakeholders. So that is as much as we can do. And I hope that will be impactful enough in terms of setting stage for the next set of activities that we plan to do together. Thank you.
Thank you.
Michelle, maybe you'll share the link as well for them to the website, the specific page under the SRHR Youth Champions Network. So that is it from me. We can conclude and say goodbye. We meet next week or next week, but one when that communication comes out to you guys.
All right. Thank you everyone for joining the session. I've really enjoyed. At least my dream for being a teacher has come true in that 1 hour. So thank you, Mar, and also thank you for participating. I've really enjoyed this session, yeah? You can always call me again and again and again. Maybe I might change my career.
And we might even poach you from MSK.
Who knows? Yeah, yeah.
So it's been a pleasure. Thank you so much for the contribution as well. It's really impactful and enlightening. Yeah. So we hope we get to engage more moving forward.
All right. Thank you, David. And thank you, everyone.
Thank you. Bye.
Okay, bye.
Bye. Bye.